Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, so any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, the nurse practitioner and NP student are discussing scabies. In which area of the body is scabies most likely to be found? Is it A, the abdomen, B, the scalp, C, interdigital spaces, or D, the back? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, in which area of the body is scabies most likely to be found? So that stem tells you everything you need to know, right? So they're just discussing scabies and they want to know where you most commonly find scabies. And the best answer is C, in the interdigital spaces, like in the webs of the fingers, okay? Make sure you know that because, again, when I tell you with derm, location, location, location. Because when you see a question that starts to talk about the webs of the fingers, interdigital spaces, between the fingers, this is classic location and presentation for scabies, okay? Question number two. The nurse practitioner is suspecting scabies as the differential diagnosis. What is the best diagnostic exam to complete to confirm a diagnosis of scabies? Is it A, a blood test, B, skin biopsy, C, observation of the characteristic rash, or D, a microscopic exam of skin scrapings? Take a moment and tell me what you got, y'all. All right, so here the stem of the question states, what is the best diagnostic exam to complete to confirm a diagnosis of scabies? And here the best answer is D. The typical exam that is typically utilized to confirm a diagnosis of scabies is the skin scrapings under the microscope. So a microscopic exam of skin scrapings, okay? That is your diagnostic exam, gold standard. I tell y'all to study assessment, diagnosis, evaluation, and treatment. Study in that format. So when you think of diagnosis and the diagnostic exam for scabies, think the microscopic exam of the skin scrapings, okay? All right, and lastly, question number three. The nurse practitioner and NP student are discussing the best treatment options for scabies. What is the first line therapy? Is it A, oral antibiotics, B, topical permethrin cream, C, antihistamines, or D, corticosteroid injections? Take a moment and tell me what you got. All right, so here, stem of the question is, what is the first line therapy? All right, so we're talking about treatment. Let's see if they have provided us with a diagnosis. And we're talking about scabies here. So what is the first line therapy for scabies? And the best answer is B, that topical permethrin cream, right? Also known as Elamite. I always say eliminate the mite because those scabies are mite bites, right? So B is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one at gmail.com. The things that I do offer are my review book. You can get that in the ebook option or the paperback option. They're both linked in the bio of this channel. If you prefer to study independently, my self-paced review course for family and adult general is also linked in the bio of this channel. If you would like to book any one-on-one sessions, I always say either reach out by calling, texting, or emailing so that we can gauge what you truly need, as I have a variety of one-on-one session options. And if you're looking to do any practice questions, my QBank options are also linked in the bio of this channel. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.